My name's Dr. Jason Roth, and I'm an ear, nose and throat specialist based in Sydney. I'm a member of the Royal Australasian College of Surgeons and have achieved international board certification in facial plastic surgery. As an otolaryngologist or ENT specialist, I treat children and adults with a wide range of issues. I've taken a particular interest in functional and cosmetic rhinoplasty, nose and sinus disorders, cosmetic surgery of the face and neck. Much of my operative work is primary revision surgery, particularly brow lifts, facelift, blepharoplasty, otoplasty and neck lifts. Since starting medical school, I've always been passionate about the anatomy of the head and neck region. I became an anatomy tutor at the University of New South Wales for a number of years, and this interest eventually led on to my surgical training in ear, nose and throat and head and neck surgery. It also motivated me to undertake subspecialized rhinology and facial plastic surgery fellowships in the United States and Europe. In order to achieve excellent surgical outcomes, proper, diligent preoperative planning is essential. My consultations are never rushed, and I encourage my patients to thoroughly understand the surgery they are having before they undertake it. Every consultation begins with me listening carefully to the particular concerns and aims that a patient has. We can then look at the pros and cons of the various treatment options that may be available to address each of these concerns. I encourage patients to ask as many questions as they like. This means that when the surgical day arrives, patients are feeling as confident and as relaxed as possible. Computer imaging can be an important part of the planning process for many operations, particularly rhinoplasty. It assists me in understanding the patient's aims and concerns, and it's helpful for establishing realistic expectations about what surgery can achieve. After surgery, I encourage my patients to see me often, and I will continue to see them until they are completely satisfied. With all my cosmetic work, I aim to achieve very natural results. In rhinoplasty, this means noses that suit a person's face and function well. In facelift surgery, I aim to rejuvenate the face by returning it to how it looked in younger years, avoiding any pulled, overfilled, or overdone appearance. Since opening my practice, we've helped many patients successfully reinvent themselves and achieve a new level of personal happiness. I feel very fortunate to truly enjoy the work that I do. What I love most about the surgery I perform is how patients tell me that since having surgery, they now have more confidence and higher self-esteem, which flows into many aspects of their lives, including relationships and employment prospects. There is nothing more rewarding than hearing patients tell you how surgery has changed their lives. I'm deeply committed to continuing to achieve the best possible results for all my patients.